Hi guys, my name is Taylor, and today I would like to talk to you guys about body dysmorphia in men. So let me just share my screen with you real quick. Pull this up. All right, so like I said, today I'm here to talk to you about body dysmorphic disorder in men. Throughout the presentation, I'm going to go back and forth between calling it body dysmorphia or dysmorphic disorder and BDD. It is used interchangeably. All right, so what is body dysmorphic disorder or BDD? Body dysmorphic disorder is a preoccupation with one or more perceived defect or flaw in physical appearance that are not observable or appear slight to others. So this might be like a small scar on your face, but you know it's small, and others see it as small, but also at the same time you're looking at it and you think it's huge and you just think it ruins like your whole face. Or someone could be looking at themselves in the mirror and they see a very fat or extremely thin person, but in reality they are of average weight for their height and gender. Um, by dysmorphic disorder, BDD is also commonly interchanged with social anxiety disorder. However, the difference between these two is that body dysmorphic disorder is what you think others are thinking about your appearance and also what you are thinking about your appearance. And social anxiety disorder is what you think other people are thinking about you and your behaviors and actions in a social setting. So that's the difference there. BDD is apparent in 2.5% of women and 2.2% of men. This is be about 1 out of every 50 people. Body dysmorphia is a growing concern and can have effect on someone's mental health and could lead to other problems. Some of those other mental health problems could be major depressive disorder, OCD. It could lead to an eating disorder such as anorexia or bulimia, or a social anxiety disorder. A person with BDD is also at greater risk for self-mutilation and suicide. Overall, women have been diagnosed with BDD more than men, as mentioned before. However, it is more prevalent in men. Men are also more commonly diagnosed with something called muscle dysmorphia or MD, and this is when men are looking at themselves in the mirror and feel that they are weak, scrawny, or skinny, and they look at other men who are like big bodybuilders and they're just very fit, physically fit, and they feel shame looking at themselves compared to these other men, which can lead to muscle dysmorphia or body dysmorphia. Possible explanations for disparities would be, again, it affects men and women differently. As I just said, men are more commonly known to have muscle dysmorphia um, as a form of body dysmorphia over women. And another huge explanation is social media. Platforms such as Instagram and Snapchats, which are apps where people are able to post pictures and videos of themselves, and other ones like Facebook or TikTok, those are all apps where people are able to share things about themselves, which is completely fine. However, the problem arises with influencers and celebrities who are posting pictures of their altered or photoshopped bodies, setting unrealistic body expectations. When I say altered bodies, I mean like medically altered, either through like plastic surgery, liposuction, whatever the case may be. And then, of course, Photoshop means going through a software system and editing the photo to make it look more desirable. These are setting completely unrealistic body expectations for both men and women. The problem with this is that it's being talked about more with women than it is with men. Women have been in the media talking about body dysmorphia and how influencers and celebrities are affecting them, but what's not talked about is how media can affect men. They are also out there seeing pictures of other men on the internet who neither have more physically fit physique than they do, or they have more or less weight than they do, or they have facial hair and they don't. It could be a whole array of things that these men are seeing, but it's just not talked about because of the stigma over mental health, men and mental health problems. And there's also a stigma with men and body dysmorphia because, thinking about it, men in society have been portrayed to be, just strong, very, nothing really bothers me, or they're very angry or whatever, and they're just, not allowed to ever show any sort of emotion or feelings whatsoever because they're men. So that leaves the stigma that if you're a man with a mental health problem, you don't really want to talk about it because you're a man with a mental health problem. Now, if you add your body into that, that is making it even worse in the sense of stigma, that men aren't really encouraged to, I guess, to talk about their body image as much as women. Going back to the social media, there was a systematic review done last year called Increase in Body Dysmorphia and Eating Disorders Among Adolescents Due to Social Media. This shows a very, very strong correlation between the rising numbers in body dysmorphia and social media usage. Their technology and social media has just grown and is going to continue to grow. And there's just going to be even more problems arising with more and more social media use. This is a problem that needs to get a handle on it. And so how does this impact social workers? BDD has an impact on a person's day-to-day life, causing them distress when they're thinking about how their appearance is being perceived by others. If you have a client with any disorder, first of all, you're not going to discriminate against anyone for any reason whatsoever. And if you have a person with BDD, it's about being sensitive to that for them and also treating them like you would any other client, regardless of what disorder they have, treating them like any other client, and also getting them the help that they need when they ask for it, if they ask for it, in relation to their disorder. And you would do that for any client of yours if that is within your job description. As I mentioned, social media has a large impact on increasing numbers of people with BDD. We're just going to keep seeing more and more of this, especially in adolescents and young men and women. BDD is different in men and women, and men are more likely to have muscle dysmorphia, and BDD can present as an ethical issue if you have a male client who is coping with BDD or MD by using steroids, which is a common method of dealing with body dysmorphia in men, is that they see these very physically fit men and then they turn to excessive exercising and they're not getting the results they want quick enough. So instead they turn to excessive exercise and steroids. Men with BDD are also oppressed because they're not able to share about their experience with BDD as much as women are, and they're not getting the same recognition in the media and in society as women are. So they're not having anywhere to talk about what they're going through, which is leading me into my next steps as a social worker. Something that we could do for men with BDD is to form a support group for them. Give them a safe space where they can talk about their experiences and their journey with body dysmorphic disorder with other people, other men who are experiencing the same thing. These men need a safe space to talk and not feel judged. I do feel very passionate about this because I have a close friend who does struggle with body dysmorphic disorder. This person struggles in it in the sense that they've recently transitioned from male to female. So when they are looking at their body, they're having a hard time seeing themselves as female because of their masculine features. So they're struggling with body dysmorphia in that sense. And since I started learning about this from my friend, I have become more and more interested in body dysmorphia in general, and I wanted to lean more towards men because men who have mental health problems, there's typically a stigma over them in general, and you add their body image into that, and it's just going to be an even higher stigma on them, I feel. So men with body dysmorphic disorder, they need our support. They need a safe space to talk about this, and they need to be recognized just as much as the women do. These are my resources. I appreciate you having given me the time to talk about this today. I think this is something that we can help men with and have them feel heard, validated, and safe. Thank you so much.